as every cell replicates, the telomere wears down. And the current theory with aging is when that telomere is all the way worn down, our cells can't replicate anymore, and that's when people die of just old age. Now, most authorities believe that the life expectancy is well over 100, like 100, 110, 115, depending on who you read. But those telomeres are not just something that universally wear down. Things can accelerate or decelerate the way that they wear down. So things like smoking, too much oxidative stress can cause a rapid wear down of those telomeres. Chronic stress. They actually have shown that people that were exposed to some type of major stress, like say it was somebody that was abused as a child or somebody that had something really traumatic happen to them at a younger age or an earlier time, that they tend to show also an accelerated shortening of these telomeres. But what's really cool is some recent research that I read showed that people that exercise regularly don't have that shortening, even if they have a history of having chronic stress or having a severe stressful situation. And they can actually genetically look at this and prove, or look at a population and see, when they look at their genes, through what we can do now with looking at genes, they can actually see that this group that exercised but had severe stress doesn't have telomere shortening, and this group that had chronic stress but doesn't exercise does. So it was really interesting to show how your body can repair itself. It's a whole nother topic that I could talk about for an hour, but one of the cool things is they used to think that your genes largely dictated your health expression. Now, current research is saying that's not true at all, that your genes, whether they're turned on or turned off, or how your genes are expressed, are what your lifestyle, basically, is what dictates your health. There was actually a landmark study called the Danish twin study. They looked at identical twins that had exactly the same genome, the identical genes, and they many times had very different health expressions. One might develop diabetes, the other one not. One might develop schizophrenia, the other one doesn't. One of them develops osteoporosis, the other one doesn't, even though they have identical genes, because it's how those genes are expressed. And the whole field of study that's literally new within the last 8 or 10 years is called epigenetics, which literally means upon genes. So the cool thing about it is it means we're not doomed to our inheritance. Okay? And it depends on who you read, but I've heard everywhere from that your genes are responsible for 10% to I've heard up to 20% of your health expression. But that means that 80 to 90% of your health expression is due to how those genes are turned on or off, or how you take care of your body, basically. Okay. All right. Nutrition is important, and again, some of this is very basic. The same recommendation I would make for just staying healthy or for losing weight or wanting to improve your overall health really applies to stress. I'll get into some specifics in a second here, but basically a diet that's high in brightly colored fruits and vegetables, low glycemic index fruits and vegetables, so basically non-starchy fruits and vegetables, that contains adequate protein and healthy fats. Now, must be the basis for fueling your body, enabling it to cope in a toxic and stressful world. I think that things like exercise and lifestyle and that are ever so more important now, because we do live in a world that's very stress-filled, and also, as Dr. Hartman presented it a couple weeks ago, we're surrounded by toxins. So healthy fats are extremely important. All of these things are important, but healthy fats especially. One of the reasons is that if you're deficient in omega-3 fats, your body cannot produce the neurotransmitters. The selective serotonin reuptake inhibitors, like the medication I talked about, like Prozac and that, they try to raise your level of serotonin, which is a neurotransmitter. If your body doesn't have adequate healthy fats, your body literally can't produce those neurotransmitters. So if you don't have enough of the building materials, basically, to build those neurotransmitters, your body can't produce them. So the other thing that's important is we talked about genes, and I know this is getting kind of complex, but every cell has a cell membrane, and they're actually discovering that the nucleus of the cell, where the gene material, actually isn't the brain of the cell, that it's the cell membrane that is really the brain of the cell. In other words, it's what gets in and out of the cell that really determines how the cell functions. And we are an accumulation of our trillions of cells in our body. So the cell membrane is made up of fat, okay, as well as your brain is made up of fat. So your level of healthy fats are very important for cellular function and for nervous system function. Okay? It's also something I stress because most Americans are deficient in those healthy fats, especially omega-3 fats, and those of you that heard me talk before have heard me talk about this before in my nutrition classes. For most Americans, it's probably the single most important supplement just because we're deficient in it. It's called an essential fat, which nutritionally means you have to have it for your body to work correctly. Some things you can do without, like, for example, your body can make cholesterol. If you don't eat enough cholesterol, it can make it. It can synthesize certain vitamins and so forth, even if you don't directly take them in. But if you don't take in these beneficial fats, your body cannot produce them. So then you develop deficiencies. It's good for preventing heart disease and lowering your blood pressure, reducing or improving your immune function, but it's especially important for, like I said, improving your levels of neurotransmitters such as serotonin. Okay? Some other important micronutrients are a high-quality multiple vitamin. I don't think people need to take, 20 different supplements every day. As a matter of fact, I occasionally have patients come in that are doing that, and I have them stop taking many times a lot of what they're taking because more is not necessarily better. But I think a good foundational multiple vitamin as kind of an insurance policy that you're getting what you need is a really good idea. Even if you do eat well on a regular basis, it's difficult sometimes to get all the nutrients you need in a fast-paced life that most of us lead. Vitamin D is also something that's extremely important. Where we live here, many of us are deficient in vitamin D, especially in the winter. And if you work inside and you're not outside in the sun during the summer, even during the summer, a lot of us are deficient in vitamin D. I see some of you are taking notes. I would write down that next time you have any blood work done at the medical doctors, I would request that they test your vitamin D levels if they haven't done that. It's a blood test that can be done, and that's the best way to gauge actually where you're at with your vitamin D levels. I usually recommend for most of my patients that they haven't had any blood work that they supplement their diet with 2,000 to 3,000 IU of vitamin D every day. But some people need 100 times more than that. Some people might take 40,000 IU. Vitamin D can be toxic in extremely high levels, but for most people it's very difficult to get those high levels. Okay, so vitamin D is something that current research over the last just 4 or 5 years has showed how important that is. I had a woman just a couple months ago that came in to see me, and one of her primary complaints was depression that she had struggled with, and she was taking some antidepressant medications. And as I'm going to talk about in a second, my adjustments helped her a great deal, but when we started her supplementing her diet with vitamin D, it caused a dramatic change. She felt so much better, and she was able to get off of her antidepressant medication and is thriving now without having to take any medication. So vitamin D is really, really important. The reason that I said that, especially during winter, is that not everybody may know this, that your skin produces vitamin D from exposure to the sun. And during the winter, we don't have enough skin exposed, but also the sun is literally just not intense enough. It's not intense enough to cause that reaction that produces that vitamin D. The great thing about sun exposure for vitamin D is that there's a mechanism naturally in your body that prevents you from producing toxic levels of vitamin D from sun exposure. So you never can get an overdose of vitamin D from sun exposure. A common thing that people ask me is, well, what about skin cancer? Don't I have to worry about skin cancer? What the research is actually clear that when you have adequate vitamin D levels, the incidence of all cancer, including skin cancer, but also breast cancer, brain cancer, bone cancer, liver cancer, all forms of cancer go down. So getting sunburned repeatedly increases your risk of skin damage and of skin cancer. But sun exposure does not. Okay? And obviously, depending on, if you have dark skin or dark eyes or blue eyes and blonde hair, you have to be a little careful about, how much sun exposure you get. But everybody can benefit from healthy sun exposure. And that brings up something that's extremely important is that African Americans and people with darker pigmented skin are especially at risk for vitamin D deficiency. So really everybody should have their vitamin D levels checked, but if you're a darker complected person, it's very, very important. Where we live this far away from the equator, very few African Americans have normal vitamin D levels because of the way their body produces vitamin D. It doesn't do it as well. Okay? So B vitamins are extremely important. I mentioned just in passing when I talked about that fight or flight response that one of the things it does is kicks in your adrenal glands. Well, your adrenal glands use up B vitamins. And so B vitamins are water-soluble vitamins that you can't take too much of, but your body needs more of them, especially when you're under chronic stress. And some people can develop something called adrenal fatigue, where basically they're under stress for such a long period of time that their adrenal glands actually, instead of dumping out all kinds of adrenaline, they actually can't keep up anymore, and they stop producing adrenaline, and it can cause a dive. It's much like somebody that is a diabetic, that their pancreas might, after years of eating too many sugary foods, just not be able to produce enough insulin anymore. Their body can also become desensitized to it. The same kind of thing can happen with your adrenal glands, which also incidentally can tie into your sex hormones and your thyroid hormone and lots of other things. So B vitamins are extremely important, especially if you know you're under a lot of chronic stress and you're trying to recover from it, or to help you in a chronic situation to take extra B vitamins. Vitamin C is good because oxidative stress can lead to stress, and vitamin C is an antioxidant. And then zinc seems to be important with people that are under stress to help again with that antioxidant effect. All right. Next, I want to talk a little bit about some techniques you can use for helping to not only cope with stress, but things you can do proactively to prepare you for when stress does occur. Because, like I said, we all unfortunately have it in our lives. Okay. So I'm actually going to have you practice this a little bit. So I'm going to have you get in a kind of a comfortable position, and I'm going to have you put one hand on your stomach and one on your chest. Okay. And it probably would help even if you kind of just close your eyes. Okay. So what you're going to do is, I'm just going to describe it first, and I'm going to have you actually practice it. You're going to take in a deep abdominal breath, like you would if you're getting ready to sing or play a music instrument. So the hand on your stomach should move more than the hand on your chest. You want to let your stomach come out as you take in that deep breath. Okay? And then I'm going to have you try to do that for a count of 4. So it's going to be a long, how long is it? Come on in. It's going to be a long, sustained breath. So it might be 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. And although your lungs don't really go to your belly, you want to imagine that you're filling all the way down to your belly. Okay? Then you're going to hold that for a count of 4. And then you're going to blow it all the way out for a count of 4. And the mental image with this is that your stomach should come in, and you should be contracting your stomach, and you should feel like you're squeezing every ounce of air out of your lungs. Okay? And then you're going to hold that with your lungs empty for 4. Okay? So let's try this. Ready? Okay? So we're going to go ahead and take in a really deep breath.